Well, a dangerous new strain of the coronavirus is alarming scientists around the world. The strain was first found in South Africa after the nation saw a recent spike in cases. The World Health Organization has classified it as a variant of concern. CBS News foreign correspondent Debora Patta has more.
The variant was detected in the last few days because of a jump in new cases near Johannesburg. While numbers are still low, just over 2,400, they doubled overnight.
This is familiar ground for South Africa, a new variant that has once again sparked fears that it could set back the fight against the pandemic. The new variant marks a huge jump in the evolution of the virus since the global health crisis began. The concern? It could be more transmissible and more resistant to vaccines, says public health expert Professor Salim Abdul Karim.
If this variant is as or more transmissible than the Delta variant, it would be very difficult to anticipate it would do anything different to what we have seen with Delta, which is that it would grow and spread across the world.
South African scientists are now working around the clock to determine just how bad this new variant is. Lab results are still a few weeks away, but many countries are not waiting to find out, with several cancelling direct flights from South Africa overnight. The new variant has largely been detected amongst young people who have the lowest vaccination rate in the country. Karim stresses it was picked up here first because of South Africa's excellent variant surveillance.
And it is true that other countries that may not have the same level of diligence may well have new variants spreading, either this one or others. They just don't know about it.
Karim stresses that even if current vaccines are less effective against this variant, they will still provide some protection against serious illness and death. Deborah?
Debora Patta, thank you. For more, let's bring in CBS News reporter and researcher Max Baer. Max, thanks so much for being here. I want to get right to it. Scientists say this new variant has an abnormally high number of mutations to a key spike protein. So what does that mean, and why is that important?
Thanks so much for having me on, Deborah. Glad to be here. So as you mentioned, scientists have identified a bunch of mutations on the spike protein in this variant. So think of the spike protein as kind of the, quote unquote, key to unlocking your immune system's response to the virus that results in COVID-19. The available vaccines basically teach our bodies and our cells to produce this spike protein, which exists on the outside of the virus, so that our immune system can recognize it and produce antibodies and other immune cells to then fight this spike protein and fight the virus. That way, if you are subsequently infected with COVID-19, your body kind of has the tools and the recognition to know how to fight it. If there are a high number of concerning mutations on the spike protein, and to be crystal clear, there is still so much more to learn about how concerning these mutations are on the spike protein. Just because there are, say, 30 doesn't mean that all of them are the same degree of concerning. So that's an important caveat. But let's say that there are a bunch of concerning mutations, then there's a possibility that the spike protein, kind of evades that key that your body built to sort of establish and learn about the virus that it can then fight. So it basically can kind of hinder your immune system's ability to recognize the virus when it enters your body.
So the World Health Organization is calling this variant a variant of concern. So, we've heard this before. What do we need to do to stay ahead of this, Max?
First and foremost, vaccinations. We need to vaccinate as many people as possible, as quickly as we can, particularly the unvaccinated. As we've seen in South Africa, the largest share of some of these cases are amongst people who are younger, which are one of the larger unvaccinated populations in the country. And then the second is instituting mitigation measures, masking, social distancing, and especially testing. And it's also critical that our public health system, which has been ramped up in the last few months, does as much gene sequencing as possible. And that basically means sequencing infections in a given area to understand what kind of variant we're looking at here. We've been doing that a lot with the Delta variant as it's risen here, and we would need to do that with the now named Omicron variant, and that's that variant just identified out of South Africa. You're also seeing some countries that are starting to restrict flights to Hong Kong, South Africa, and other neighboring countries, and that's also policy that's being considered as well.
Got it. Of course, vaccination is so important for so many people. Got to get everyone vaccinated who can. So back in the U.S., let's talk about this. Several Republican-led states like Florida, West Virginia, and Arkansas, they're now adding exemptions to vaccine requirements for people with so-called natural immunity. So what is natural immunity?
To put it simply, natural immunity is just your body developing immunity from fighting off direct COVID-19 infection naturally without vaccination.
Got it. So how can people who have recovered from COVID-19, they've had it, they've come through it, how do they prove that they have a similar antibody response as those who have received the vaccine?
So therein lies the problem with some of these policies, which is that those kinds of tests are not readily available for the general public, as they tend to be more labor intensive and require a lot of lab work. While there are blood tests to identify whether or not you've had prior COVID infection, those tests don't further identify the degree of neutralizing antibodies your body may have built, and doesn't test them against the kinds of variants that are circulating. So while somebody might be able to go and get a serology test, a blood test showing, oh, you've had prior infection, that doesn't inherently mean that you have natural immunity. Because again, that would be determined more based off of how your immune system responds to certain kinds of vaccines. So that's really some of the things that might hinder policy like this, or make it difficult to implement or difficult to trust one's natural immunity, is that there are not tests available to actually see what degree of immunity your body has built just by fighting the virus naturally.
Right. So that leads me to this question. How are governors able to add this exemption? And how does it ultimately line up with President Biden's vaccination rules for large employers?
Well, that's a great question. I mean, I think the error in some of this policy would be the fact that, again, conflating natural immunity to protection to the virus, or I should say natural infection with immunity to the virus is I think the issue here. Just because somebody has fought off the virus without vaccination doesn't inherently mean that they have the immune response that means they won't get infected again seriously or spread it to somebody else. From President Biden's vaccine mandates, there hasn't been a clear they haven't clearly made this caveat available. So it would seem that in these states where some of these policies are being enacted, there's going to be a coming to the head of these potential exemptions with the mandate instituted by the federal government.
Well, we really appreciate you being here. Thanks for keeping us smart, Max Baer. Appreciate it. Stay safe.
Thank you. Have a great day.
You
Likewise.
too.